起还是分几次？
你是问他
都可以。
都可以。Okay. She got a question. Okay. Do you do supra and sub the same time, or you separate them into two different appointments? Supragingival, subgingival, or you do it
at the time of oral hygiene instruction, I remove the supragingival calculus because to get a better result of toothbrush. Otherwise, we do the same time. Yeah. But the insurance system of Japan, we have to separate in supra and subgingival. But that's stupid for me.
It is so stupid for me. In my practice, because I started using ultrasonic almost like 20 years ago, probably earlier than you do. So I've been through ultrasonic, magnetostrictive, and the piezo, both major brands of piezo I've been using. I usually tell my patient, we can do the whole mouth, severe periodontitis. They definitely need injection to numb their teeth, otherwise they cannot survive through the whole treatment. So because I use a microscope, June and I just had a little discussion yesterday during the dinner. I use the microscope. So I tell my patient, I need only 2 appointments. And if you come from China or you come from Japan, you really have such a short time in Taipei, I can do it in 1 visit. Full mouth, subgingival. The pocket may be like 6 millimeter, 8 millimeter, or even beyond 10. But that doesn't bother me at all because I have a microscope. I can see through into the microscope. I can look at the root surface. I can see clearly where the contamination is. Of course, I cannot tell which bacteria it is, but I can see the contamination. So for those deep pockets, I use local anesthesia injection because it's the most effective thing. But if it's like a 4 millimeter, 5 millimeter, even with heavy calculus, I sometimes don't give them any anesthesia and they can survive.
Yeah.
Okay, there's a way to do it. You have to know how to do it very meticulously using your Cavitron tip or whatever ultrasonic tip as a probe, just like you're probing around the tooth. So that's why the Dentist Plus Verona is so kindly to give you this paper, which I wrote just last month. I coined the term probe scaling. Just use the ultrasonic tip as a probe. So you can just go around the tooth. Okay, if in between severe periodontitis and the mild periodontitis, there's another alternative. You can just use 20% benzocaine gel and just use your tip and scrub it into the gum, around the gum or into the pocket. And I can assure you it's sufficient enough. Okay, because some of the patients, they are allergic to local anesthesia. I sent 2 of my patients in the last 20 years to emergency room just because of the anesthesia. They have symptoms. They feel the heart is like broken and that they are dizzy. So I have to send them to Guotai Yiyuan for emergency. And the doctor told me, it's only for the injection, no big deal. So they just lie down there for like a half day, they can go home. But be careful because what happened to me might happen to you, right?
Yeah, exactly.
And also we had a little discussion yesterday about the dental implant treatment. What is the most important thing if you want to place implant in your patient's mouth? Not how much bone they have, not how great the implant surface is. It's the periodontal healthy status. Trust me, if bacteria can attack the natural tooth, they can also come back to attack your implant. So no matter how good you are surgical skill, like Dr. Young Linda, 45 minutes for 3 implants, well actually I can do that in 15 minutes. And because I do flapless. And no matter how many implants you put, 1, 2, or 10, or 20, remember, have your patient to come back regularly with the ultrasonic to maintain both tooth and the implant surface. Because if you don't do that, bacteria will come to you and your patient. Okay, so the most important thing is not the bone quality and the bone quantity, it's the periodontal health, periodontal status. Agree?
Agree. Yeah, implant does not treat the periodontitis.
Exactly.
It's just a tool for rehabilitation. In case of Bronnemark Clinic, I several times I referred to them for the implant therapy, but many of them will come back because of they still have a periodontal disease. So the treatment of perio first, please, and they are very strict, even the implantologist, for the condition of periodontal tissue. Please remember that.
So, if a patient come to your clinic for dental implant consultation, please don't just look at the bone quality and the bone quantity or how much attached gingiva he has or she has. Look at the periodontal pocket or periodontal, the gingival sulcus first. That's the first thing I would tell my patient. You need to remove all the bacteria before you can get implant. Just like if you go to the surgery, what did the doctor do first? They scrub. They give you injection to make sure that the infection can be controlled. Then they go ahead to do the surgery. Otherwise, you have sepsis. Is that right? Is that right?
Yeah.
Yes. That's why I'm the moderator, because I'm saying the same concept with him. How do you do the maintenance for the dental implant? They have the soft tip, the Captron have the soft tip for implant, and I will have him to answer your question first.
Just cream rubber cup around the implant fixture. Yeah, that's a very important thing, is to remove the plaque. And if there is any calculus, they try to use, there's no standard way, but in my case, we try to use by hand scale for the calculus. And the soft tissue, a soft tip of Cavitron, I don't use, to be honest, I don't use so much, but in my colleague presented a case, Dr. Otsuki, he said that they're very useful for the treatment and maintenance, or in the case of mucositis, because the EMS machine, the soft tissue, is drop away easy during the instrumentation, but Cavitron is never drop out. He said, yeah, this is, I don't have so much experience, sorry.
If I'm having a peri-implantitis patient, what I do, I don't like to lay a flap. Trust me, I don't like to lay a flap. I don't like to do surgeries. I only have very limited experiences in treating peri-implantitis because I don't have that kind of patient in my practice, because they always come back every 6 months, always. But I do have peri-implantitis. Just last year, I had a patient I haven't seen for 18 years. I did the implants in 1965. I'm that old. I did implant for him in 1965. He never came back to me for 18 years. When he came back, he has peri-implantitis. I got nothing to do, so I said, why don't we just go ahead and do the scaling by the ultrasonic device. So I put very slim, very thin, and it's like a periodontal probe. I put into the peri-implant pocket and then just go around the implant surface. One thing Dr. Ono hasn't mentioned, because of the time limitation, is ultrasonic not only have vibration, chipping, the mechanical force, it also has the water irrigation, right? Originally, water irrigation is for cooling the tip, because otherwise it will get very hot. But later, I think it's a British scholar, Dr. Lee Wormsley. You know him. Yeah. Wormsley wrote a lot of paper. You can go back and read his paper.
But you can see the movie in the YouTube.
Yeah, in YouTube. You just type in Wormsley, W-A-L-M-S-L-E-Y, whatsoever. I'll give you that name later. So he wrote a lot of paper doing some research on the water irrigation. He found that water irrigation, when hitting that highly vibrated tips, it bounced back as acoustic microstreaming and the cavitational effect. That is such high power water stream, so it can just flush away the bacteria, and sometimes you can just use the water to flush away the calculus. It's unbelievable. But with that, think about the implant surface. Almost all the implant surfaces have the threads, the pig, the valley, the pig, the valley. So how can you do instrumentation to every part of the surface. There's no way. In this sense, water, power, acoustic microstreaming, and cavitational might come into help. That's my personal experience. So let's come back to that 18-year disappeared patient. I use that, and when he come back in 3 months, I can see the bone is starting to grow. But I don't have a large patient pool on this kind of cases. So I can only say it's my personal feeling, my gut feeling, my intuition that that ultrasonic instrument is the best for peri-implant treatment. Your comment?
Very good control.
Okay.